Hello everyone, I'm Dr. Michael Anderson. If you're over 60, or you have parents or loved ones in that age group, this is one of the most important videos you'll watch. Because today, we're talking about surgeries. Not all surgeries are life-saving. Not all surgeries are necessary. And some can actually do more harm than good, especially as we age. So in this video, I'm going to break it down very clearly. 3 surgeries older adults should seriously avoid unless absolutely necessary, and 3 surgeries that can dramatically improve and even extend your life. Let's start with the ones you should be very careful about. First, spinal fusion surgery for chronic back pain. This is one of the most commonly overused procedures in older adults. Now, if you have severe spinal instability, trauma, or nerve damage, yes, it can be necessary. But here's the problem. Many people with general lower back pain are being recommended spinal fusion when the root cause is actually muscle weakness, poor posture, or age-related degeneration. Spinal fusion is a major surgery. It permanently limits mobility in part of your spine. Recovery can take months, and in many cases, patients still have pain afterward. In fact, I've seen patients come back with the same pain or worse after going through a very invasive procedure. For most people over 60, conservative treatments like physical therapy, targeted exercise, weight management are often safer and just as effective. Second, knee replacement too early or without full evaluation. Knee replacement can be life-changing. We'll talk about that later, but timing matters. I often see patients who rush into surgery because of pain without fully trying physical therapy, anti-inflammatory strategies, strengthening surrounding muscles. Knee surgery is not a quick fix. Recovery can take months, and complications increase with age. If your pain is manageable and your mobility is still functional, surgery may not be the best first option. Third, aggressive prostate surgery in older men with slow-growing cancer. This is a very important one. Not all prostate cancers are life-threatening. In fact, many are slow-growing and may never cause serious problems, especially in older men. But surgery can lead to serious side effects: urinary incontinence, erectile dysfunction, reduced quality of life. In many cases, active surveillance, careful monitoring, is a safer and smarter option. The key here is not fear, it's precision. Treat what needs to be treated, not everything that looks abnormal. Now let's switch gears. Let's talk about surgeries that can truly change and even save your life after 60. First, cataract surgery. This is one of the safest and most effective procedures in modern medicine. As we age, the lens of the eye becomes cloudy. Vision declines slowly, and many people don't even realize how much they've lost. Cataract surgery replaces that cloudy lens with a clear artificial one. The results? Sharper vision, better independence, lower risk of falls and accidents. And the procedure itself is quick, often under 30 minutes, with a very high success rate. This is not just about vision, it's about quality of life. Second, hip replacement for severe arthritis. When done at the right time, hip replacement can be transformative. I've had patients go from barely walking to living active, independent lives again. Chronic hip pain leads to reduced movement, muscle loss, increased fall risk, and that creates a downward spiral. A well-timed hip replacement can break that cycle. The key is proper evaluation and choosing the right moment, not too early, but not too late. Third, heart procedures like stents or bypass surgery when clearly indicated. Heart disease remains one of the leading causes of death, especially after 60. If you have significant blockages in your coronary arteries, procedures like stenting or bypass surgery can restore blood flow and prevent heart attacks. These are not optional in many cases. Delaying necessary heart treatment can be life-threatening. The important part is proper diagnosis and working with a cardiologist who evaluates your overall health, not just your age. So, what's the takeaway from all of this? Age alone should never be the reason to avoid surgery, but it also should never be ignored. The real question is always this: does the benefit clearly outweigh the risk? For you, not for statistics, not for guidelines, for your body, your lifestyle, your goals. Before agreeing to any surgery, I always recommend my patients ask 3 simple questions. What happens if I do nothing? Are there safer alternatives? And how will this impact my quality of life long term? If you don't have clear answers to those questions, you're not ready for surgery. Let me be very direct with you. The goal after 60 is not just to live longer, it's to live better, to stay independent, to stay mobile, to stay mentally and physically strong. And the right medical decisions, including surgery, can either support that or take it away. I'm Dr. Michael Anderson. If this video helped you think differently about your health decisions, share it with someone who needs to hear it. And remember, the best treatment is not always the most aggressive one. It's the one that's right for you. I'll see you in the next video.